Welcome back to Chapter 15, Module 15 lecture on endocrine system medications. So previous to this, we were talking about type 1 diabetes at the end of part 1 of the lecture. That was type 1, that was insulin dependent. And so starting off with part 2, we're going to now be talking about type 2 diabetes, and that's the non-insulin dependent diabetes mellitus, or NIDDM. So patients with type 2 diabetes may still produce insulin, but the body is unable to lower glucose levels in the blood, and so the body responds by producing more and more insulin until the pancreas finally cannot keep up with that demand. And so treatment for type 2 diabetes includes diet and exercise, and if needed, if diet and exercise doesn't work, we look at oral diabetic agents, and these medications encourage the pancreas to release the insulin. So which type of diabetes has normal production of insulin but unexpected response from glucose? Let me read that again. Which type of diabetes has normal production of insulin but unexpected response of the glucose? Correct. You should have selected diabetes type 2. Okay, and again, we talked about type 2 being the non-insulin dependent, and that's because there is a production of insulin. Let's talk a little bit more about medications that treat type 1 diabetes. So type 1 diabetes, again, does require insulin for treatment, and there are types of insulin. So short acting is prescribed on a sliding scale. What a sliding scale means is the dosage is given depends on the actual assessed blood sugar, and it is administered before meals. Intermediate acting, which is mixed with substances that slows the absorption by the body. This is cloudy in appearance and requires mixing before the injection. And then there's also long acting, and this can last up to a full day and a half as far as how it is distributed through the body. So insulin preparations are divided into the 3 categories based on how quickly they start working and their length of action. Again, they include short acting, intermediate acting, and long acting insulins. It's important to know how quickly insulin begins to work and how long its action is so that the patient can plan timing of injection and meals accordingly. So it's also important to note that different categories of insulin can be mixed. This provides coverage in one injection, and it can be done by the patient, or it can be commercially prepared. So it depends on the type of mixed medications. And you can also refer to table 15.3 for some specific examples here. Insulin should be refrigerated until the vial is opened. This helps so that it extends the shelf life from 1 to 2 years if it remains refrigerated. After being opened, the vial should be kept at room temperature, and this helps to avoid painful injections, but must be discarded within 1 month once it's opened and left at room temperature. It's also important to avoid temperature extremes because this will help avoid damage to the insulin. If the insulin is exposed to extreme temperature changes, then it will be damaged. Again, refrigerating the insulin will extend the shelf life up to 1 to 2 years, and open insulin should be kept at room temperature. And we want to make our injections less painful for the patient, so it's important to make sure that it is stored at room temperature once it's opened prior to giving the injection. Also, you see here in this picture an example of an insulin pump. So a patient with a history of the hyperglycemia or poor control would utilize an insulin pump, and this is only used with short-acting insulin if you're using the pump. It's important also when handling insulin that we rotate the insulin injection sites. This helps to prevent scar tissue or abscesses to develop at the injection site, and it also ensures that the insulin is more evenly absorbed, keeping glucose to a steady level. So steady glucose levels delay or minimize complications of diabetes such as neuropathy, eye and kidney damage, and cardiovascular disease. Checkpoint number 4, or comprehension checkpoint number 4, how often may a site be used to inject? So I didn't mention that previously, so we'll go over this. This is the rule of thumb is that the injection site, should be used no more than 1 time per month, and it should be 1 inch away from other injection sites. So let me say that again. The rule of thumb is that injection site should be used no more than once per month, and each injection site should be 1 inch away from each other. Okay, so looking at this comprehension checkpoint, how often may a site be used to inject insulin, you would have selected C, once a month. Now we're going to look at medications that treat type 2 diabetes. And we talked about this in several of the slides previously, that diabetes type 2 can be managed with diet and exercise. But if that doesn't work, then we need to use an oral diabetic. Okay, and that's an oral diabetic medication. The anti-hyperglycemic drugs, these encourage pancreas to release insulin, and others encourage the liver to tell the pancreas to actually release the insulin. Whether a drug is first or second generation is based on when they release that drug. So a second generation anti-hyperglycemic medications tend to be more potent and tend to be safer because they were released in the second generation. So they were more recently released. Patients lacking digestive enzymes, so we look here at cystic fibrosis. The ducts in the pancreas are blocked with thick mucus and thus cannot secrete these enzymes. So then we need to use replacement enzymes. So we have Ultraze, Creon, and this must be taken with every bite of food for the rest of their life if they have cystic fibrosis. And this again was mentioned back in a previous slide in the lecture. Adrenal disorders cause either too much or too little hormones to be secreted. So we're going to look here at Addison's disease, and this occurs when the adrenal cortex under-secretes glucocorticoid hormones and causes chronic fatigue, muscle weakness, anorexia, nausea, vomiting, diarrhea, hypotension, hypoglycemia, sweating, irritability, and weight loss. This disease, so Addison's disease, is treated with oral hydrocortisone, which is a synthetic corticosteroid. Now let's look at Cushing's disease. So Cushing's disease occurs when the adrenal cortex oversecretes the glucocorticoids and causes symptoms similar to Addison's disease, except that patients experience hypertension and hyperglycemia instead of hypotension and hypoglycemia. Patients also develop a fatty hump between their shoulders. They have upper body obesity, rounded faces, And women have excessive hair growth on their face, chest, abdomen, and thighs. Treatment may include surgery, radiation, chemotherapy, and cortisol inhibiting medications. So anabolic steroids are composed of male hormones called androgens. They change the natural balance between tissue breakdown and building, and these are used for prevention of muscle wasting in patients with age, or they're also used to rebuild tissue after severe trauma. An example of this is oxyndrin. And anabolic steroids change the natural balance between the tissue breakdown and the tissue buildup. Again, what I want you to remember is they are used to prevent muscle wasting in patients with age and to help patients with severe trauma to rebuild tissue. Those are the medical uses. Side effects, because these medications have severe side effects and are often abused by athletes trying to build muscle mass, they are considered a Schedule III controlled substance, okay? Because again, athletes want to try to build muscle, so they are using them and not taking into account the severe side effects. So they are Schedule III controlled substances. Some of these side effects are aggressive behavior, rage, atherosclerosis, sterility, liver cancer. And let's go ahead and do our final comprehension checkpoint number 5. All of the following are acceptable uses of anabolic steroids except, and hopefully you selected C, assisting in conditioning of athletes. I hope you've learned a lot about endocrine system medications this week, and I look forward to seeing you in class. Have a great day. Bye-bye.